Hi everybody, my name is Dr. Peter Nord and I'm a physician at Providence Healthcare. Lately we've been seeing a significant increase in the degree and the frequency of caregiver stress. I'm here with Ann Spalding, who also sees quite a lot of this in our outpatient areas. And I was in a family meeting this morning and I had an elderly patient that I was going to be discharging home. And their children in their 50s were in the room, and clearly they were quite stressed about having the thought of having to take care of their parent as they come home. They also confided that they have some stress at home looking after children, so they're sort of torn in two different directions. Is this something that you're seeing quite a lot of now?
It's playing a huge factor, and we do know statistically that Canadians are more stressed dealing with work and personal responsibilities, and that number has increased. It's more than doubled in the past 10 years. You add into that mix the decline in the economy, job insecurity, and the care of an elderly parent with a progressive illness such as dementia, the stress level is huge.
Mm-hmm. So, Anne, how do caregivers know if they're headed for burnout?
The problem is that they don't often recognize that they are stressed, or they are denying that they are stressed. And we need to be able to somehow to reach them. And we do that by using a stress inventory. And part of that can include, have your sleeping patterns changed? Have your eating patterns changed? Are you more irritable? Are you less able to focus at work? And if the individual can reply yes to those, it's indicative that they are stressed.
So, Anne, what resources are available to somebody if they think they are under stress and may be headed for burnout? Where can they turn?
The resources available are caregiver support, a peer support group, education about the illness. Knowledge is a very powerful weapon. It can help them better manage the challenges that may lie ahead. A good starting point is your family physician, through your local community care access centres, through the Alzheimer's Society of Toronto, Heart and Stroke.
Mm-hmm. So, Anne, prior to actually accessing resources, is there anything that a person can do to really help themselves?
For themselves, they need to be able to admit they need help, ask for help, and let your family know what kind of help you need. They need to think about the 3 Ps, prioritizing, planning, and pacing themselves. So for prioritizing, if the matter isn't urgent, if it's not life-threatening, put it on the back burner, take care of it another day. For planning, take some time, plan even half an hour to go for a walk, soak in a bathtub, and to pace themselves. Know your limit, know what you can do well today, and leave the rest for another day.
Terrific. Well, thanks everybody for joining us today. This has been a discussion, I hope it's been helpful for you, around caregiver stress.